Welcome to the webinar Tag in Action, Wisconsin Patch. The Successful Strategies for Improving Adolescent Health webinar series is sponsored by the HHS Office of Adolescent Health. This webinar is one of a series highlighting local, state, and national efforts to improve adolescent health and is part of a national call to action called Adolescent Health, Think, Act, Grow, or TAG. My name is Evelyn Kaplan. As Director of the Office of Adolescent Health, or OAH, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health out in the field. This webinar will highlight an innovative effort in Wisconsin called Providers and Teens Communicating for Health, PATCH. Today we're joined by Amy Olejniczak, the Associate Project Director and Program Director for the Wisconsin Alliance for Women's Health. Before I turn it over to Amy, I'd like to tell you a little bit about the Office of Adolescent Health and TAG. The Office of Adolescent Health is located in the U.S. Department of Health and Human Services. OAH was first funded in 2010 and charged by Congress with developing a national plan for improving adolescent health. OAH has used its resources and the input of experts to synthesize what we know about what works in order to spur action in support of adolescent health. In this webinar, we're pleased to be able to shine a light on a program that is engaging young people in improving their own health care. TAG builds on existing research and the collective work and insights of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, yet there are many missed opportunities to promote adolescent health and to intervene promptly as challenging health issues emerge in adolescence and young adulthood. TAG is a comprehensive, strengths-based, positive youth development approach to adolescent health, rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside of the healthcare system. The goals for TAG are the following: to raise awareness about the importance of adolescent health, to engage stakeholders, youth-serving organizations, and caring adults, to get adolescent health on the national agenda, and to spur action. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health developed by the U.S. Department of Health and Human Services. More details about TAG can be found on the Office of Adolescent Health website. Also, before we begin, we like to point out that the content and views of this next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health or of HHS. I'm now pleased to turn things over to Amy to learn about the Providers and Teens Communicate About Health project, or PATCH, which is based in Madison, Wisconsin. This project aims to improve the ability of healthcare providers and teens to communicate effectively about sensitive health topics, and it has had some promising results. Amy?
Thank you, Evelyn. Thank you so much for having me. Again, my name is Amy. I am the Associate Director for the Wisconsin Alliance for Women's Health, which serves as a parent organization for PATCH. We're a fairly small but scrappy nonprofit and are very thrilled to lead a program as exciting and innovative as PATCH. PATCH stands for Providers and Teens Communicating for Health and is dedicated to making sure that young people are not only accessing health services, but are also having high-quality experiences. There we go. I'm able to advance my slides. So let's just start by taking a moment to talk about adolescent healthcare. You know, teens are a group that make up a population that's mostly healthy. So why are we so concerned that they seek health care? Well, for starters, this stage is a critical time when patients start thinking about healthcare and whether that's something that they want to be engaged in, whether they're going to be smart consumers of healthcare or not. So regardless of their current healthcare needs, it's really important that we engage them during this phase, allowing them to really build trust within the healthcare system so that it's there for them when they do need it. You know, in addition to providing really important preventive immunizations, managing chronic conditions, promoting healthy behaviors, health professionals also have a very unique ability to offer a confidential and safe environment for talking about and providing services related to all sorts of very sensitive health topics. For teens, you know, that really involves mental health, sexual health, body changes, drugs and alcohol, and so many others. Yet, adolescents are also the age group least likely to utilize preventive care, least likely to return for follow-up care, and most likely to have a failed patient-provider relationship. So why is that? Well, there are a lot of challenges and barriers that impact the effectiveness, the quality, and also the satisfaction of care received by teens. First, they're very reluctant to disclose sensitive information. They don't often understand confidentiality, where it starts or where it ends. They definitely don't want to hear or don't want other people to know about their personal information. Frankly, I think when a provider asks personal questions, it often feels like none of their business. There's also a fear of being lectured or judged. You know, young people get lectured and judged all the time at school, at home. They may think, you know, why should we ask for it at the doctor's office too? All of this really hinders an open and honest dialogue between teens and their healthcare professionals, whether it's lying by omission or falsifying information. It really prevents healthcare professionals from being able to provide the care that their patients truly need and deserve. On top of that, let's face it, our healthcare system is very complex, especially from the viewpoint of a teen who has probably had their parents or guardians taking care of this stuff since infancy, making appointments, filling out paperwork, refilling prescriptions, asking questions. There's a lot of uncertainty and inexperience in navigating a complex system. And finally, barriers to accessing care that many of us face, like clinic hours, insurance, cost, transportation, on and on, those are simply compounded for young folks who have less independence and less power to really manage their own lives than adults. Which brings us here to our PATCH mission and vision, which are pretty straightforward. PATCH envisions a supportive environment in which all adolescents are able to reach their optimal health, safety, and economic security. And our mission is to improve adolescent health and well-being by educating, engaging, and empowering youth and adults as trusted partners in care. Here at PATCH, we recognize that there are a lot of areas in which adolescent health is directly impacted, from education in schools, values formed at home, to clinic-wide, statewide, even national policies and practices. And at PATCH, we really work to impact the adolescent health in all of these areas. Currently, we're developing a new set of resources for parents and guardians to use within the home in working with their teen patients. We're also finishing up our first year of piloting a PATCH Youth Advocate model in which teens from all over the state of Wisconsin are directly engaged in local and state policy change. We're also getting ready for a broad dissemination of PATCH for Teens, our classroom edition. This is a new program, a lesson that can be implemented by health teachers and youth workers as part of a broader healthcare curriculum or health education curriculum. This is a curriculum that includes instruction for a one class period lesson plan. It's recommended for grades 9 through 12. It uses very interactive videos created by our teen educators for their peers, other activities and lessons and learning tools to create a very interactive lesson. So folks in your local school systems that you may know are looking for effective ways to teach healthcare access to youth, please put them our way, tell them to get in touch, or watch for updates as we roll out a new website in May. And finally, we are finishing up our 7th year of implementing our core PATCH program, which is based on our incredibly successful teen educator model. and really looks to create impact through the patient-provider relationship at the clinic level. And this is where I'm going to focus the rest of our conversation today. So what is the core PATCH program? Well, at the start of each program year, which is the start of the school year, we recruit, hire, and train approximately 12 teen educators at any given program site. These are youth between the ages of 14 and 18. They enter a school year-long curriculum upon being hired, in which they engage in bi-monthly enrichment education and are trained to deliver our two core workshops, PATCH for providers and PATCH for teens. We're also very dedicated to continuous and robust program evaluation, which happens throughout the entire program year. But at the heart of our program is our workshop. So PATCH for Providers is a 90-minute CME and CNE accredited workshop for all types of healthcare professionals. Learning objectives of this workshop include an increased knowledge about the concerns, fears, preferences, and priorities of teen patients, as well as skills and resources to facilitate open, honest, and effective communication with teens. We also aim for increased confidence in personal ability to provide high-quality care to teens by creating a really confidential, non-judgmental environment that allows teens to be open, honest, and feel supported. And finally, we work toward behavioral intentions to utilize the knowledge, skills, and resources to create this confidential, non-judgmental healthcare environment for teens. The PATCH for Teens workshop is a peer-to-peer workshop in which the teen educators empower their peers and begin to learn to manage their own healthcare experiences. Throughout the years, we've found three different aspects of healthcare to be very important to youth, and we've really structured the PATCH for Teens workshop around these three concepts. Those are relationships, rights, and responsibility. So this is a 45-minute curriculum that really uses interactive teaching techniques, games, videos, and conversations, and a peer-led format that really focuses on those three concepts. Oops, I think I jumped ahead. These are what you're looking at here. These are our 2016-2017 PATCH Teen Educator teams located in Milwaukee and Madison, Wisconsin. And our programming is very youth-driven. We actually hire and train the teens to really be thought of as part of our staff. We take pride in the diversity of our teen educators. They vary in race, socioeconomic status, sexual and gender identity, geographic location, family life, religious practices, overall life experiences. It's very important to us that they come from different grade levels so they can become mentors to each other, and from different schools throughout the community so that they can bring diverse voices and experiences. Yet they all share the same vision, and this is to improve the health of their own generation. The authentic insights and experiences of our teen educators have led to continuous growth and development in our programming. The teen educators undergo a very rigorous interview process, which I'll talk about in a little bit, and they're hired based on this unique combination of wanting to share their life experiences and really use those experiences to teach others, and also their ability to communicate in a very effective way. There are 4 things I think we do uniquely well here at PATCH that have allowed us to be very successful in our programming. First, as I mentioned earlier, we're based on an employment model in which our potential teen educators go through a fairly intensive interview process before being hired. They're also paid for their time with our program. This provides valuable workforce experience, and it also keeps the teen educators engaged and really allows PATCH to be a priority in their life. It also allows us as youth workers to really walk the walk. We demonstrate that their voice matters, and we value their time enough to really compensate them accordingly for that time. Next, we implement a very robust training model in which teen educators go through a 24-hour training at the beginning of the program year and then experience ongoing enrichment as they learn and grow in their roles. So while some of this training is fixed, the teen educators also have the opportunity to provide insight and suggested topics for enrichment training based on what they want to learn a little bit more about or what's currently going on in the community or in their lives. This year, I believe our teen educators were very interested in adding enrichment topics related to disability in use, just in healthcare, and also we had some additional conversations on race and equity within their communities. We set very high expectations for all of the guest speakers that come into our enrichment space to really ensure a quality experience at all of our trainings. We also boast a really powerful empowerment model, as our teen educators are trained to be the sole facilitators of our workshops. So they're given the opportunity to stand in front of a group of healthcare professionals as the experts. They lead them through a series of learning activities, and it's a really beautiful thing to watch the tables being turned when youth are given a position of power. Additionally, we really encourage advocacy opportunities and informal leadership roles. We often see that teen educators become kind of the known expert within their school or friend groups, the ones that other teens go to for advice. And finally, we're very deliberate and confident in our youth-adult relationship model, which is based on trust and respect. Though we're very clear about the boundaries and transparent about our program goals, we work to treat these teen educators as colleagues and really encourage their voices in program improvements, again, giving us that opportunity to really walk the walk. We're incredibly proud of the impact that Patch has had, which really has exceeded our hopes and expectations. Our evaluation has showed that providers participating in the Patch for Providers workshop have demonstrated significant improvements in knowledge, self-efficacy, behavioral intentions, and even some self-reported change in behavior at the clinic level. Teens that participate in the Patch for Teens peer-to-peer workshop demonstrate significant improvements in knowledge, self-efficacy, and behavioral intentions, and those are related to their ability to seek and receive the care that they need. I also love this quote here by one of our Patch Teen educators, current Patch Teen educators, Rose, who says, "Patch gave me confidence in public speaking, a new and unique community of friends each year, opportunities in public health, insight, knowledge, compassion, and so many other things I'll never be able to put into words." So we're just now getting better at really evaluating the experience of our teen educators as they go through the year-long curriculum. And though their numbers are small, with just 10 to 12 a year at each program site, the impact is large. We're very proud of the program growth that we have experienced. We began in 2010 with a one-time $10,000 grant from the National Institute for Reproductive Health out in New York. We are now in 2 locations here in Wisconsin, working on a 3rd, and are ready for national replication. So we've taken that initial program, we've gone through a rebranding, we have grown in our scope and in the content that's included in our curriculum, and we've also grown in both geography and locations and also populations, really bringing parents and other community members into our conversation. In fact, we're very proud to announce that in just a few weeks, we'll be partnering with Erie County to form a Buffalo, New York Patch team, our first national replication site in May. And with that, I would just like to thank you and encourage you to join Buffalo and in joining our Patch family. Please do reach out to me with any questions, any thoughts, or collaborations. I want to thank you for listening. Give a special thanks to the Office of Adolescent Health for inviting me to share about our program, and encourage you to learn more by visiting our website, patchprogram.org.
Thanks, Amy, for such a wonderful presentation. We'd like to take a few minutes now to ask some questions about some of the work that you've been doing. How did you come up with the idea of having adolescents train physicians?
This was something being done by the National Institute for Reproductive Health back in 2010, and we were so grateful to have their guidance in this innovative approach as we formed the Patch program. That our early work was really focused on improving communication between youth and doctors around sensitive sexual health topics. So really talking about sexual health options in a supportive environment. We quickly realized that the teens themselves are the best population to really offer providers accurate and authentic advice and insight about a wide variety of adolescent concerns and preferences. And really learned that if we wanted to improve communication between healthcare professionals and teens, we really needed to change the model. So our program now gives providers the chance to gain the sort of privileged access to this unique population on a wide variety of topics and a wide variety of settings.
And how do you develop your curriculum and select your topics?
We expanded our curriculum after hearing directly from the community and through our evaluation that additional topics were needed. So, in fact, what I remember most clearly kind of telling me that we needed to expand our topics was when healthcare professionals would come up after some of our early workshops and would say, this is amazing, that teen voice is amazing, being able to be sort of vulnerable with young people and ask questions of them is such an important thing. But this is only scratching the surface. We have so many different questions about a variety of topics that aren't just related to sexual health, and we'd like to be able to ask those of the teen educators and learn how to set a safe environment regardless of topic for the youth. So that's sort of how we expanded our approach and recognized that there are a lot of issues that teens might be coming forward with and needing a safe space to talk about them. So equipping healthcare professionals to be prepared for those variety of experiences has really become central to our programming. This sort of experience of listening to our audience members and our community is also, how we've grown in scope. We also expanded our audiences, as many of the health professionals who were in our audience were also parents. So they would also come up after workshops and say, we'd really like to have our parent friends hear this information as well so that they can best support their teens as their teens transition from that pediatric care to adolescent health care, and how they can be both supportive and effective in giving teens the independence to start managing some of that on their own. So really just listening to our partners, our evaluation, and our participants.
And can you tell us a little bit more about the role of youth in shaping and delivering the curriculum and some of the lessons that you've learned?
Absolutely. Youth are absolutely central to all we do. So each class of teen educators has really added to the scripts and lesson plans that we use within our workshops. They've each also sort of put their own spin on delivery and really advocated for changes to the approach. We've learned so many lessons in forming youth-adult partnerships. We do believe that it all comes down to mutual respect, clear expressions of sort of valuing that youth voice, and again, going back to that, paying youth for their work. We've really learned that not only empowering them to believe in themselves, but really demonstrating concretely, showing them that their time is important, that we value their voice, we value their time, their thoughts, their opinions. I'd say that's the main takeaway is giving them that space and also giving them that respect and recognition. And in doing so, we'll get the best work from them. We'll really allow them to sort of own the program and take it to a whole new level, which has been a really inspiring thing to see over the years.
So what are your plans and goals for Patch moving forward?
Well, as I mentioned, I'm so excited to see this model expand nationally. I'm excited to go out and work with some folks in Buffalo, New York in just a few weeks. I really believe that with that scope change in our programming, that all of the programming will be improved as we learn from each other. We build our Patch community of practice, so to say, and really experience how the program can be effective with some modifications for other communities. And that's my goal, is to really connect with folks from all over to look at what we can do to bring Patch into the community, to start creating change with the youth, the providers, the parents, and really watching that grow. And I also want to say, if anyone is interested in learning more about what it would mean to have a Patch program in your community, I would love for you to reach out to me directly. We have a Planning for Patch guidebook that has been very helpful for many partners in kind of thinking through whether or not Patch is a good fit for your adolescent health community and efforts that are ongoing. And I'd be happy to get that into your hands.
Thank you so much, Amy. On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about OAH and TAG and to hear about the wonderful work being done in Wisconsin. Special thanks to Amy Olejniczak for sharing this program with us. The TAG effort continues, and we invite you to get involved and spread the word about TAG within your professional network. And here are a few things you can do. I encourage you to explore our website, check out the TAG playbook. You can join TAG and get email updates. You can watch one of the TAG Talk videos with your colleagues. Notify your colleagues and grantees about TAG. You can encourage your organization to use TAG action steps and resources. You can blog about TAG. You can see that in the TAG toolkit for a sample blog. You can ask questions, share ideas, and stay in touch with us. And I encourage you to use the TAG social media tools to reach some of America's 42 million teens and adults who care about them at hashtag 42mil. Again, here are some of the specific ways you can connect with the Office of Adolescent Health and with TAG. Explore our website, download materials, and sign up for e-updates. Watch us on YouTube. Send your ideas and suggestions to tagteam@hhs.gov, and you can follow us on Twitter at TeenHealthGov and use hashtag tag42mil. Thank you again for giving us the opportunity to share TAG and some great examples of TAG in action with you today.